Assalamu alaikum wa rahmatullahi wa barakatuh. Esteemed viewer, once again, welcome to your program Health Check, a program where we bring medical experts to give us some medical advice regarding certain ailments. And today, we are discussing eye ailments or diseases of the eye, and in particular we are discussing the topic of discussion today. We are going to have an overview of the diabetic retinopathy, call it the DR in the short form. I have an eye expert from Bali, traveled 300 kilometers. That is Dr. Herbert. You're most welcome.
Thank you so much for having me.
Thanks for honoring our invitation, and please never get tired of us. That is Dr. Herbert. He's been a friend of ours. He's been visiting us here and then. Several Humanity First camps, Gift of Sight camps, he's been coming and giving some treatment to some patients. Dr. Herbert.
Yes, sir.
The DR, in short form, that is the diabetic retinopathy.
That's right.
What is it exactly? It's something new to my ears.
Something new to your ears.
Yes.
Yet very common. Okay.
Very common to my eyes.
Yes.
Okay.
So diabetic retinopathy is, these are two words.
Okay.
We have the first word, which is diabetic, and the other, which is retinopathy. So that means that this retinopathy is being caused by the diabetes.
Okay.
Retinopathy is coming from the retina, and destruction of the retina, or destruction of the retina, is what we are calling retinopathy.
Okay.
Yeah, so it's one of those irreversible causes of blindness. Irreversible causes of blindness that we have, and that is very rampant and on the rise worldwide.
Seriously?
Yeah, so it is a disease. Diabetic retinopathy is a disease due to diabetes mellitus. It's a complication due to diabetes mellitus.
Okay.
Yes, and causes the small blood vessels inside the eyes, inside the part of the eyes called the retina, is being damaged slowly. And as they are damaged, they cause other complications inside the retina, which will cause damage of the retina and in turn cause poor vision or even blindness, as we shall learn as we go on. So that is basically, in brief, about what diabetic retinopathy is.
Okay.
Yes.
So the main cause here, you said, is diabetes.
Yes.
Okay. So I want to ask for causes, but let me ask for the risk factors at least.
Yes. So the first thing is having or being a patient of diabetes.
You're at a very high risk.
At a very high risk. And especially those that have type 2 diabetes, because we have diabetes type 1 and diabetes type 2.
So type 2 is the worst.
Yeah, so this condition is more rampant.
Okay.
The cases are more rampant in people with diabetes type 2.
Okay.
Diabetes mellitus type 2. Yes.
Okay.
Yes.
The risk factor number 1.
So that's the risk factor number 1. So uncontrolled blood sugars due to diabetes mellitus is the leading cause, or it is actually the cause, the definite cause of diabetic retinopathy.
Okay.
Uncontrolled blood sugars.
And what are the symptoms?
So the symptoms,
someone might be there not knowing that they are diabetic.
Yes.
Okay?
Yes.
But at least with your advice today, they might know that they are diabetic through the symptoms of this RD.
Yeah, so thank you very much. Now, just to tell us something about diabetes. Diabetes mellitus can happen if there is insufficient production of a hormone called insulin in your body. So if there's insufficient production of insulin in your body, that means there's going to be a high buildup of sugar in your blood, which will cause diabetes.
Okay.
That is one. It can also happen if your pancreas, which is responsible for producing the insulin, is either damaged or sick or absent. Some people are born without a pancreas.
Seriously?
Yes.
And how do they survive?
Yeah, so definitely the person will become diabetic from childhood. Now that's type 1 diabetes.
So you have to inject the insulin.
Yeah, so they have to be injected with insulin
throughout their life.
Yes, to control the amount of sugar that is in their body.
Okay.
Yes. So if now the cells of the body, this is another cause of the diabetes, are no longer able to, the receptors of the cells of the body are no longer able to know that there's a high blood sugar, they will not send messages to the body that produce more insulin.
Okay.
That is another thing. So someone has the pancreas, has insulin there, but the cells of the body are no longer able to sense that this sugar is too much. It should be controlled by you sending more insulin in.
Yes.
So that's how some of the ways that someone can get diabetes mellitus.
Okay.
Now, some of the symptoms of this disease is that someone will lose weight. That is one. Two, they'll have frequent urination.
Okay.
Someone wakes up in the night about 5, 6, 7 times to urinate.
In the night.
Yes. Then they'll be eating a lot. Every time they're hungry, they want to eat a lot. That's another symptom.
Okay.
The other one, they're ever thirsty. They want to drink water every time the body is demanding. Drink water. So those are some of the symptoms that you could look at and say, maybe, because I wake up 7 times to urinate in the night, maybe I have diabetes. Okay?
It's high time you ran
It's
to
high
the
time you
doctor.
go and have a checkup. I'm ever thirsty. I take water, but ever thirsty, ever hungry. I want to eat. I want to eat food all the time. Sweating. Oversweating. It's not hot. The temperature is okay, but you keep sweating. Yeah, so those are some of the symptoms that they could open your eyes to say, maybe I have diabetes mellitus, and run for an eye checkup.
Okay.
Now, back to the eyes, symptoms of diabetic retinopathy. After we have seen that we have uncontrolled blood sugars. These uncontrolled blood sugars, remember, we have blood vessels even up to the eyes. Now, this blood is moving in the body and it's moving in these blood vessels up to your eyes. When it reaches your eyes, it's also going to cause complications. So diabetic retinopathy is one of the complications that is caused by uncontrolled blood sugars, among many other complications.
Okay.
So today our topic of discussion is diabetic retinopathy, which is one of those complications that comes due to uncontrolled blood sugars.
Okay.
So some of the symptoms that you will have: blurriness of vision or reduction in your vision. Blurriness of vision. Number 2, you could see floaters, something we call
By blurry, you mean your eye can't focus?
Yeah, you can't see clearly.
Okay.
You see vaguely. Before you could see clearly, you can see the wall clearly, you can see whatever is on the wall clearly, but now everything is vague in appearance.
Okay.
It is blurry. It is not as clear as it used to be.
Okay.
That is one. 2, you could see floaters in your field of vision. Like I'm looking at you now, but I see some things moving around. Moving around. I keep wondering, is it an insect moving around my eyes? You try to chase it
Yet
away,
there is
but
nothing.
there's no insect. So probably there could be bleeding inside the eye, and that blood is floating in the vitreous body. So it is floating and you think that maybe it's an insect outside. So if you have floaters and you are diabetic, you could be having diabetic retinopathy. Calm. Frequent change of spectacles. They checked you this month, they prescribed spectacles. After 1 month, these spectacles can no longer work. You want more? Come for a checkup. Probably you could be having diabetic retinopathy.
Okay.
You frequently change your spectacles. Yes.
Okay. Thank you so much, Dr. Herbert, for such a wonderful teaching and advice. There is a myth that I want you, I don't know if it's a myth or not.
Yes.
For this, at least, we are both witnesses. Diabetes is more in the elderly people as compared to the young ones. The young one is there, but not at a hike as compared to the elderly.
Yes.
Is it true what people say that the DR is only, the diabetic retinopathy is only in the elderly people, not in the young ones? How true is that information?
It's not entirely true because anyone with diabetes can have complications.
Okay.
And they can have complications in the eyes as well. And diabetes does not affect only the elderly. It is also affecting the younger ones, like we have learned. Yeah, so it is a disease without age. It's not an age-related disease.
Okay.
To say that it should only affect the elderly or the younger ones. It can affect anyone that is having diabetes mellitus. But also, we can importantly note that it is more common among the elderly people than the younger ones.
Okay.
But does not mean that the young ones cannot suffer from it.
Okay.
They can suffer from it as well, but it's more common in the elderly people than it is with the younger ones.
Okay. Thank you so much, Dr. Herbert. At this moment, I would like to invite in our brother who's been online for quite some time. That is Dr. Hamza Busonya. And the reason I'm inviting him in is we need to know whether the diabetic retinopathy is curable or not. If it is curable, what some treatments would you prescribe to someone that is already diagnosed with this ailment? Dr. Hamza Busonya, to you now.
Hello everyone, my name is Sonia Hamza, an ophthalmic clinical officer. So I'm going to talk about diabetic retinopathy, which was earlier introduced by Dr. Herbert. So diabetic retinopathy, this is generally microangiopathy of the blood vessels that is in the retina of the eye, and it always affects our blood vessels in that whenever our blood sugars are so high, even our retinal cells and blood vessels are affected in that they are always susceptible to damage, so they can easily rupture and cause bleeding. So there are different risk factors that can alleviate the effects of the diabetic retinopathy. Let's say there are cases of, depends also on the duration of the diabetes, or for how long one has had the diabetes. So the most common type of diabetes that is associated with the diabetic retinopathy is always the type 2. And in most cases of patients with type 2 diabetes, they also have cases of hypertension. So it also is a risk factor in causing adverse effects. Other factors include pregnancy and also poor control of the blood sugars. So essentially, before we talk at the advanced ways of managing the diabetic retinopathy, the first thing is always to control our blood sugars in the normal range as it is advised by the physicians. Then, since this diabetes has different stages, we always manage it according to the stages. So let's say in the early stages, we can always have some little bleeding at the retina, and that is always managed by giving some intravitreal anti-VEGF factors. That is the vascular endothelial growth factors. So we give anti-VEGF factors that try to reduce the growth of the blood vessels to prevent complications like neovascularization at the retina, which can further cause other complications. Then we can have in advanced stages like the proliferative and the pre-proliferative diabetic retinopathy, whereby there is advanced effects, or we can have much bleeding and also development of corneal spots. So that is always better managed. Like we always advise for laser treatment, whereby they can do laser treatment and try to clog those blood vessels that are bleeding. Then in advanced stages, whereby you're having like a whole set of complications, we can have cases like retinal detachment, and we always refer to retinal surgeons for such cases. Thank you.
Well, thank you so much, Dr. Hamza Busonya. That is it. That is the treatment. Yes, it is treatable, just as we've heard from him. How treatable is it? We have Dr. Herbert here will help us with that. But before we go to that, we had a patient once diagnosed with diabetic retinopathy, and we need to know the journey to recovering the sight back again. And here I want you to assist us and help us to know some of the challenges that these people meet.
Yes. Thank you very much. Now, important also to note is that the most important treatment for such a patient is to control their blood sugars.
Okay.
That is first and foremost, that every patient that is diabetic, and you're out there and listening to us, the most important thing, or the first thing to do to prevent these complications, is to control or to manage your blood sugars.
Okay.
Yes. Adhere to the treatments and adhere to the rules and regulations that they give you.
Okay.
Yeah. In tandem to the disease that you're suffering.
Okay.
Okay. Now, what challenges do we face?
Yeah, the challenges they face
in managing. Okay, so some of these challenges are physical, others are economical, others are social. Yeah, because it is expensive to manage this disease.
Okay.
That is for sure. And
Expensive.
some of it's expensive. And the treatment it depends on the kind of stage that the disease has been diagnosed.
If it is stage 2, like you told us,
yes,
it
so
is
because there are 4 stages, and depending on the stage, also the management could be expensive depending on the stage.
Should we assume the higher the stage,
the more expensive
to manage?
Yes. And we also noted that it can cause irreversible blindness once you don't get the treatment.
Okay.
But the most important thing is to manage or control the blood sugar.
Okay.
Now that the blood sugar has not been controlled and we have complications, and we have started the treatment in the eyes, one of the challenges or the barriers that we are facing is the economic constraints. Some people cannot afford.
Okay.
Yeah, because sometimes these patients need laser photocoagulation. It's very expensive procedure. Sometimes they need injections, maybe 4 or 5 times into their eyes. And these injections, every dose is very expensive, very expensive. In some of the hospitals that I've seen where it is a bit cheaper, one injection is about $350,000.
Oh.
Or $100, I can say.
That is $100, yes, approximately.
So, approximately. So not very many people can afford this.
Yes,
and sometimes they go without treatment, and it will cause irreversible blindness. You know, so one of the
most of
challenges,
the people opt for going blind for the rest of their lives, not willingly, but because they can't afford the treatment.
Okay. Yeah, so it's one of those biggest challenges we have in management of diabetic retinopathy. The economic constraints, the financial constraints of the many of the patients. Very expensive to manage this disease. Number 2, physical constraints, like we don't have very many experts. Like this disease is specifically managed by an ophthalmologist who has also, again, specialized in the retina, who is also called a retinal specialist or retinal surgeon. We don't have very many of those in this country, or even in Africa, let me say.
Africa at large.
We don't have very many of such retinal specialists.
Okay.
Yeah. So actually, I could count in Uganda. We have, I don't know if we have even 10 or 15.
Seriously?
Yeah, seriously. Yeah, so you see.
Yet the cases are so many.
So also the access to the treatment is another big challenge. Few professionals, few experts.
Where you're heading, I see it very complicated. It's getting even more complicated.
Yes.
Now that the treatment is very expensive, okay, depending on the stage of the diabetes or the disease, what advice or precaution or preventive measure do you have to our brothers who cannot, because not many can afford, not only in Africa, but in Europe as well. This treatment is very expensive. What advice do you have for people that, or preventive measure, let me ask for that actually.
Yeah. Okay, the first thing to be very cautious about once you are diagnosed with diabetes mellitus is to make sure that you adhere to your treatment. Some people, we have seen very many cases, someone takes their treatment for 1 month, and they forget, or they give it up for many reasons. Others, maybe the treatment is expensive. Others are simply not adhering to the treatment. They're trying other ways, trying other means, like traditional medicines, you know. And when you miss the treatment, the blood sugars go high, and now complications start setting in. So the first thing, if you're diabetic, please adhere to your treatment. If they've diagnosed you with diabetes and have prescribed treatment for you, whether it is insulin injections, whether it is tablets to swallow, please adhere. Then, of course, there's a lot of lifestyle modifications that this person has to do. Okay. They might tell you not to take any sugary drinks anymore, any beverages. You have to comply. They might tell you to reduce the salt intake, comply. They might tell you have to give up certain foods. Say, stop eating these foods, stop eating these foods. Just adhere and comply to the treatment that the doctors have advised you with. Then you'll have less complications as well. Okay? Yeah, so it is important that you prevent the complications by adhering to the treatment, to the treatment that the doctor has prescribed. Number 2, going for regular checkups. Very, very important.
Yes.
If the disease is discovered early and treatment is initiated early,
I think
you
for
might not-
both diabetes
Yes.
and the diabetic
retinopathy.
retinopathy.
That's right. For both the diabetes and the diabetic retinopathy, regular checkups, regular health checkup is very important.
Okay.
Because once they discover a disease early, they will treat you. You may not go into the complications.
Okay.
If the complications are setting in, if you're already diabetic and complications are setting in, they might be realized early and you get treatment early before you go into irreversible blindness.
Okay.
Yes. So it is important, very, very important,
Okay.
to have regular eye checkup.
Thank you so much. And this is the time I have to sign out because there are some other faith-inspiring programs that are coming in. But the good news, we are not stopping today. We still have more programs. Next episode, just tune in MTA for Africa for this very program. Next time, the same time, inshallah. Until we meet again, I remain your host, Namba Ali Bashir. Wassalamu alaikum wa rahmatullahi wa barakatuh.